It is 20 minutes after 8, and of course, lots of talk about coronavirus. The guest that we've already have pointing out some very, very interesting scenarios that we still need to contend with as a nation. There are many challenges, but of course, there is another interministerial meeting, a briefing, as it were, to give us further headlines and perhaps further substantial measures in terms of how to deal with the coronavirus outbreak. As promised, we're also going to put a call through to the Department of Education just to get some clarity to some of the parents who are asking questions about not just when kids will remain at home from, but also exactly what they can do to help in this time. Right, we're going to take a quick recap on our question of the day, and we asked you, what is your reaction to the drastic measures to curb the spread of the coronavirus in the country, as announced by President Cyril Ramaphosa last night? Right, this one is from Louise, who says, had 3 months to ensure our country was safe as usual. Our checkpoints were put in place, those were faulty, and this is South Africa for you. TB, AIDS, we can't even get meds for this for years. What makes me think that corona will be any different? I am Gwanele Mabuza says, thank you, Mr. President. I welcome your decision and consideration for business and our people. It was not easy to try and balance things given the circumstances. Stogos Mpatiwet. Baby Pana says, what about us university students? Are we supposed to go to campus like nothing is happening? Well, I think some universities have actually communicated with their students that they have also suspended classes. So just check with your institution. I'm sure if they haven't yet, it will be coming shortly. Bridget Lekwane says, there isn't much mentioned about healthcare workers. It's worrying because every sickly person seeks medical care at the clinic, and we're not armed for this pandemic. Tandazam Simang says, Kwatwa is still without water. How are we going to wash our hands thoroughly as instructed? Truly speaking, I foresee disaster coming our way. We need water in our taps as soon as possible. Smartum Tunzi's contribution this morning. We are happy the cabinet finally took action, even though it's a bit late. But let's all focus and participate. We can curb the virus. Lucky says this government lacks strategy to deal with this. COVID-19, local health facilities don't have necessary equipment. No, we don't even have water in our taps. Steve Twete, local municipality, Extension 8. How are we going to wash our hands? Must we use soil? And please call me movement at Mudise Setwaba says there's no toilet paper or soap in public clinic. How can they provide sanitizers? Let's hope this COVID-19 essay doesn't spread in a taxi or on a train. So those of your responses coming through really thought-provoking this morning, and in as much as people are grateful that the government is taking this seriously, some feel it's too late, some feel more needs to be done, and as I said, that interministerial briefing may provide some more clarity and give more light in terms of direction on what to do. Now, South Africa has joined a list of nations taking drastic measures against the coronavirus pandemic. President Cyril Ramaphosa declared the COVID-19 crisis a national disaster and announced the closure of South Africa's borders to all foreign nationals from countries that have been highly impacted by the coronavirus pandemic, including the United States and Britain. The president also announced the closure of schools from Wednesday and banned public gatherings of more than 100 people. The cabinet ministers involved in Ramaphosa's response plan will brief the media at 10 a.m. this morning about specific interventions. So for more on what to expect, we cross now to our reporter who has been very busy this entire weekend. Chriselda Lewis is, of course, now in Pretoria, and we say good morning to Chriselda. What are we likely to expect from the ministers this morning, Chriselda?
So, Sakina, following what some have described as a very decisive and bold move by President Cyril Ramaphosa last night in describing how South Africa plans to deal with the spread of the coronavirus. This morning, a group of ministers will brief the media on the detailed government plan. So some of the ministers we're expecting here this morning would include the Minister of Health, Department of International Relations, Justice, Transport, as well as Tourism. Of course, these are the ministers who are going to outline, Sakina, how all of this, the decisive action that we saw from the president last night, how all of this is going to affect most of these departments. You would recall that the Minister of Tourism was also in the forefront of communicating about exactly how much this has already started impacting tourism here in South Africa, issues of transport, how is that going to affect the transport sector, as well as, the economy, Sakina, which is very important. You know that South Africa at the moment, its economy is not doing too well. What does all of this mean for job creation as well as, job losses in the medium to long term? So we're expecting some of those things to be outlined here. The president, of course, as you indicated, declaring this a national disaster. We're sitting at 61 confirmed cases of the coronavirus here in South Africa. So the president really could not be seen to be doing nothing. Sakina, you would know some of the tweets that you read there. Some South Africans saying that the president had acted too late. But you would know, from some of the commentary that we've also seen, is that many others are also indicating that this is not a decision, Sakina, that can be taken overnight. One has to take into account, the repercussions of taking the step that the president took last night, the consultation that needs to happen. And what you'll also find is that most countries have taken steps pertaining to what they will do in their nations, pertaining to how risky it is for their country. So certainly South Africa could not be seen to be using the approach that it has been using all along. The president needed to change that approach, and now we see these the implementation of these drastic measures, which certainly would indicate that South Africa needs to be seen to be playing its part in the containment of this particular virus. So we're expecting quite a lot of details on how the various sectors in South Africa will be affected, because South Africa's plan in terms of job creation here in the country, this is really going to take a knock. And certainly this is something that we cannot overlook, Sakina, in terms of the ramifications. We've seen them already. In particular, I mentioned the tourism sector, but a massive impact that will be long-lasting, especially towards South Africa's economy in the medium to long term. So it'll be very interesting to hear what these group of ministers will say pertaining to how we're going to deal with the knock-on effect. But I think for now, what certainly needs to happen is exactly what has happened. South Africa certainly couldn't see it as business as usual.
Well, Chriselda, I'm sure we cannot wait, and people looking for further clarity and I guess more micro measures in terms of what to do going forward with regard to combating this. Well, we'll leave it there for now, and Chriselda Lewis, of course, monitoring those developments for us. And in other news this morning,